vaccinated as a child, along with some reasons behind the hesitancy towards vaccinations. Vaccines work by training the immune systems to fight off harmful diseases, but taking the time to understand the hows and the whys is a major key to making a healthy choice because you're now being informed. Vaccines are essential for building our immunity and preventing the spread of viral infections. According to the CDC, recent article published in August explaining how vaccines work states that vaccines help the body to learn how to defend itself from diseases without danger of a full-blown infection. The resulting protection can last a lifetime, and also vaccines work by intimidating the infection to engage in bodily functions and of the natural diseases. An antigen can be weakened or kill bacteria. An antigen is also an active ingredient found in all the vaccines. On this picture, you can see that the little green parts are the antigen on the disease, and it's trying to replicate to learn, or so the body can learn how to fight it off. Antigen is any substance that can cause the immune system to produce antibodies. Antibodies are proteins produced from the white blood cells to identify and neutralize any foreign substances. After neutralizing the antigen, the white blood cells become a memory cell to be able to recognize any future substance much faster. And in this picture is what antibody looks like on the white blood cells. A common question that's asked is, can a person still get infected after being vaccinated? Yes, it is possible for a person to get infected when freshly vaccinated due to the weeks of immunity development. But a vaccinated person is highly unlikely to experience severe illness when vaccinated, and also the illness is mild and shorter illness duration, and also resolves within a few days or a week. Those people that are sick and vaccinated is less likely to experience respiratory issues or even hospitalization. A study found in an article in the 2020 article on how vaccines work by Aiko Ashwaki and Shahad Omir really explains the evolution of history, science, and the progress of future developments. The research study estimated that around 103 million cases of childhood diseases were prevented from 1924 to 2010 due to U.S. vaccines. And this chart shows you like the total is 153 million children that were saved due to childhood vaccinations. And then underneath the chart, the total, you have like all different types of diseases that cause sickness and the cure rates of the vaccinations. Currently, scientists are working daily to develop new vaccinations due to the improvement of technology and the constant development of new pathogens. Protecting ourselves inside and out is the first way of prevention to viral infections. Some ways to prevent is environmental cleaning, like frequently disinfecting touch surface on objects. And a second way of practice would be practice safe hygiene, like hand washing, isolation when sick, and then practicing to cover your mouth and nose when coughing or sneezing. Even though there is information available about this topic online, there is still heavy disagreements on whether vaccines are safe or not. Vaccines in childhood could lead to a worldwide prevention, but the hesitancy is real and could be for many reasons to why people oppose the vaccinations. According to Owatawson, George, and Anshul Kapoor, in the 2024 issue journal from the Cleveland Clinic Journal of Medicine states that those who previously declined vaccination are more likely to accept it if they trust their healthcare provider. As a doctor, the approach to an individual who is hesitant about vaccination is usually effective and educational. It is not acceptable for the medical field or for society to try and persuade an individual or judge one for the choice of their opinion on vaccination. Some reasons behind the hesitancy can be due to religion, miscommunication, and the safety concerns on vaccination. Also, the lack of insurance and low-income households. But yet, some people may have experienced an allergic reaction from an ingredient in a previous dose of vaccinations. The best option in healthcare is to build trust and acknowledgement to address the public concerns instead of dismissing the opinions. It is recommended by doctors to start vaccination at a young age, typically at 6 months, to begin developing the immunity from potential harmful diseases. In the 2020 article, Why Vaccination Matters by Anita Sheck and Adrian Yannis estimates that childhood vaccination has saved around 2 to 3 million lives worldwide each year. Vaccine is the most effective approach to reducing childhood diseases. Those who are up to date with vaccines are less likely to visit the hospital, and the most common infection in children currently is the flu, aka influenza. And due to that, a seasonal flu vaccination is reformulated each year to target the 4 strands of flus that are common and yet deadly. To sum it up, vaccines remains one of modern medicine's most effective tools for preventing serious illness and saving lives. In this speech, I have explained some reasons on how it can be beneficial in childhood vaccination, the improvements made, and the preventions against infections, but yet most importantly, providing an understanding to why some people may be hesitant. Staying educated with the credible information can help be informed and make healthy decisions. Vaccination is also a person's choice, but is also a collective responsibility as a community to stay safe and protected.